Cadeau. He's the Republican chairman for Luce County, and we're real proud of him. He's also the district coordinator for Campaign for Liberty, which is a great organization we should all be part of, especially with what's going on right now. I'm here today because I'm mad at my government.
Yeah!
I mean, I am really angry at my government. I used to be a little bit afraid of them. I'm a pro bono attorney, and I got discouraged seeing that the courts and the agency ignored the Constitution and the rule of law. So I quit practicing for a while. I even quit voting. I decided to homeschool my kids. I was going to keep them out of the government schools. I was going to keep our heads down and under the line of fire, you know. But I don't feel that way anymore. And I'm encouraged that a lot of people are beginning to speak up. I'm angry that Michigan, which was once the promised land for people seeking honest work and a good life, is hemorrhaging like no other state in the country. The state and local debt equals about $7,000 for every man, woman, and child. And that amount goes up every time somebody leaves Michigan to find a job. Since 2000, we've lost 324,000 private sector jobs. We're in a single state depression, yet the government keeps growing. Government consumes and industry creates. But the health care plan, H.R. 3200, makes me really angry. There are lots of citizens who do without medical care. Of course, we don't really know how many, because every number I've ever seen includes illegal aliens. Healthcare reform is required, but putting the government in charge of it is such a mistake. Everything the government runs is broken. Social Security, Medicare, Medicaid, the post office, they're all bankrupt. They don't have any need to provide what customers require like private industry does. Free market competition gives us better doctors, revolutionary treatments, and allows us to personally decide how much we value our own lives. Are there any veterans out here today? Hey! Thank you for coming, but tell me about the VA, would ya? The Veterans Administration, how they distribute medical care to veterans. Our veterans have earned the best health care that government can provide. And I'm afraid that's probably what you're getting. The best health care that government can provide. None of the vets that I know would wish the nightmare that they experience with the medical bureaucracy on the rest of the country. It's not the government's job to decide who gets treatment. It's none of their business. You know what my president said yesterday? I read it in the Washington Times. He is so very arrogant. He said that there is a vast Republican conspiracy to kill his health care plan. He said they don't want to give me a victory. He's taking this thing personally. He thinks it's about him. Submitting our physical bodies to government control from birth to death is supposed to be his personal trophy. Anybody else got a problem with that?
Yeah.
I also have a problem that he thinks that our opposition to government-run health care is just a political ploy. He doesn't believe we're actually considering our grandmas and our unborn babies. Shame on him. This is not a partisan issue. This is human life we're talking about. But the administration's choice of advisor should give us a clue about the value they place on human life. John P. Holdren is Obama's chief science advisor. In 1977, he wrote a book called Eco Science, Population, Resources, Environment. And this is a quote from the book. Indeed, it has been concluded that compulsory population control laws, even including laws requiring compulsory abortion, could be sustained under the existing Constitution. He even writes about putting sterilizing agents in our water supply and our staple foods.
Boo!
Another key advisor to the president, Dr. Ezekiel Emanuel, has taken heat for his discussion of rationing health care. And here's a quote from him in late 1996. He says, "Services provided to individuals who are irreversibly prevented from being or becoming participating citizens are not basic and should not be guaranteed." Now, what is a participating citizen? Remember Terry Schiavo? For my money, Terry Schiavo participated more than most of us in terms of influencing our attention and opinion, and she never left the bed in her nursing home. And besides, who decides what person is irreversibly prevented from participating? Miracles do happen, but we can't expect them from cookie-cutter government health plans. Government-run healthcare, by definition, cannot avoid rationing, with bureaucrats deciding who is worth the expense. Here's a real-world example. I watched an interview with a woman named Barbara Wagner. She had cancer. Her doctors recommended a specific medication, but she had the misfortune to live in Oregon, which has a state medical program. Oregon refused to pay for the medication. Apparently, they don't pay for chemotherapy meds that only extend life. Instead, Barbara got a letter. They offered her some other help, and here's a quote from the letter. They offered her physician aid in dying. This is government-sponsored and financed assisted suicide. I can't imagine a harder blow than hearing that your life has no value. How have we sunk this low? People matter, every one of them, but not in Oregon. Oregon's program started 15 years ago, and since then there have been breakthrough treatments, and they've been used regularly in other places. But the Oregon plan has no mechanism to recognize these new treatments. It's bad enough that FDA regulations keep new drugs off the market for years, and they put physicians in jail for using treatments that are commonplace miracle cures in other countries. There's no way for a statutory program to keep abreast of all the medical possibilities. Again, less regulation, not more, is key to the highest quality and the lowest cost. And of course, individuals must be valued, not just as the percentage of likelihood of successful treatment. I've been thinking a lot lately about Lincoln's Gettysburg Address. You know, at the end of it where he says that our government is of the people, by the people, and for the people? Government is heartless, and this cold entity must not be permitted to make crucial, life-altering decisions for our loved ones. H.R. 3200 must be opposed. It is basic population management. They want to manage us like cattle. And this, of course, is of the government, by the government, and for the government. Human life has inherent, intrinsic value, whether the government believes it or not.
Yeah.